Thank you, Speaker. My question is to the Minister of Health. On Monday, we learned that in the last 10 years, there's been a 60% increase in hospitalization and emergency room visits by children and youth due to mental health disorders. The minister responded by suggesting that drugs were the answer. Does the minister truly believe that the solution for this mental health crisis is providing free drugs?
Thank you. Minister of Health, Long-Term Care.
Well, Mr. Speaker, I'm quite certain that that wouldn't have been my response. So I'll give the opportunity to the member opposite to perhaps clarify her recollection in the supplementary, but I'm very proud of the investments that we have made and are making in children and youths and adults' mental health, Mr. Speaker. In fact, when we first launched our 5-year plan for mental health that came out of a select committee of all parties that gave remarkable advice to the government, to this government, we focused in the first instance on children's mental health, and we were able to expand the services to more than 50,000 additional children that would benefit. We made investments in the orders of hundreds of millions of dollars, and in fact, Mr. Speaker, we continued that important work, and we're investing in that critically important transitional period.
Answer.
The mental health services for youth, and I'm happy to talk, including about what we've announced in the budget last week, Mr. Speaker.
Thank you. Supplementary.
Thank you. I'm pleased that you were talking about the Select Committee on Mental Health and Addictions, but that was 8 years ago, Minister. Today, 12,000 children and youth are waiting for mental health services in Ontario. In Toronto, the average wait time for counselling and therapy service is 208 days. In Barrie, the wait time is 354 days. In Ottawa, children wait 575 days for mental health services. Our kids can't wait. Instead of suggesting that drugs are the answer, when will this minister ensure timely access to counselling and therapy service for our children?
Thank you.
Mr. Speaker, I'm glad the member opposite mentioned Barrie, and I might have to defer to the member from Barrie for part of this answer, because not that long ago, several months ago, we announced a brand new child and youth mental health service in Barrie at the Royal Victoria Hospital, an inpatient service, Mr. Speaker, but also an outpatient service which is going to benefit 50,000, tens of thousands of children and youth in that area, Mr. Speaker, and it's merely one example of the investments that we're making. $140 million of additional funds announced in this budget, Mr. Speaker, for cognitive behavioral therapy, for a proven psychotherapy intervention which is remarkably effective for individuals, including children and youth that have mood disorders such as anxiety and depression. 1,150 new supportive housing units. These are the kinds of investments that we continue to make, not just for children and youth, but for the entire population.
Thank you.